Overall cancer death rates continued to decline among men, women, children, and adolescents and young adults in every major racial and ethnic group in the United States from 2015 to 2019, according to the latest annual report to the nation on the status of cancer. From 2014 to 2018, overall cancer incidence, or new cases of cancer, remained stable for men and children but increased for women and adolescents and young adults. This year's report, published October 27, 2022, in Cancer, also highlights longer-term trends in pancreatic cancer, as well as racial and ethnic disparities in incidence and death rates for many individual cancer sites. All of the findings in this report are based on data from before the COVID-19 pandemic. Today's report is good news in our fight against cancer and is a reminder of the importance of President Biden's Cancer Moonshot Initiative, said Department of Health and Human Services Secretary Xavier Becerra. I'm deeply impressed by the progress we're making against cancer and firmly believe we can meet the President's goal of reducing the death rate from cancer by at least 50% over the next 25 years. We can and must end cancer as we know it. The annual report to the nation on the status of cancer is a collaborative effort among the National Cancer Institute, NCI, part of the National Institutes of Health, the Centers for Disease Control and Prevention, CDC, the American Cancer Society, ACS. The report is based on a combined cancer incidence data set from NAACCR composed of data collected by CDC's National Program of Cancer Registries, NPCR, and NCI Surveillance, Epidemiology, and End Results, CER, program, as well as mortality data from CDC's National Center for Health Statistics. The report shows that from 2015 to 2019, overall cancer death rates decreased by 2.1% per year in men and women combined. Among men, death rates decreased by 2.3% per year. Among women, death rates decreased by 1.9% per year. The findings in this year's annual report to the nation show our ongoing progress against cancer, continuing a more than two-decade trend in declining mortality that reflects improvements in preventing, detecting, and treating cancer, said Monica M. Bertagnolli, MD, Director of NCI. I look forward to working with all our partners in the cancer community to meet these challenges head-on, because people affected by cancer, and that includes all of us, are counting on it. The report showed that cancer incidence rates were relatively stable in men and women combined from 2014 to. For women, incidence rates increased for 7 of the 18 most common cancers: liver, melanoma, kidney, myeloma, pancreas, breast, and oral cavity and pharynx. In women, melanoma had the steepest increase in incidence, rising by 1.8% per year, and thyroid cancer had the sharpest decrease, falling by 2.9% per year. We are committed to improving the lives of all cancer patients and their families, through accelerating research, increasing access to care through advocacy, and by providing direct patient support in communities across the nation, toward the shared goal of eliminating cancer as we know it. Among overall cancer incidence rates were lowest among non-Hispanic Asian, Pacific Islander, API, and Hispanic people. Among adolescents and young adults ages 15 to 39, overall cancer incidence rates increased by 0.9% per year from 2014 to 2018. The overall cancer death rate decreased by 3.0% per year from 2001 to 2005, but the decline slowed to 0.9% per year from 2005 to 2019. The incidence of breast cancer, the most common cancer among adolescents and young adults, increased by an average of 1.0% per year from 2010 to 2018. The researchers noted that racial and ethnic disparities exist for many individual cancer sites. From 2015 to 2019, prostate cancer death rates were stable among non-Hispanic white and non-Hispanic black men but decreased among non-Hispanic API, non-Hispanic AI, AN, and Hispanic men. The exceptions were non-Hispanic API women, among whom breast cancer death rates remained stable, and non-Hispanic AI, and women, among whom breast cancer death rates increased and colorectal cancer death rates remained stable. Factors such as race, ethnicity, and socioeconomic status should not play a role in people's ability to be healthy or determine how long they live, said Lisa C. Richardson, MD, MPH, Director of CDC's Division of Cancer Prevention and Control. CDC works with its public health partners, within and outside the government, to address these disparities and advance health equity through a range of key initiatives, including programs, research, and policy initiatives. We know that we can meet this challenge together and create an America where people are free of cancer. This year's report includes a special focus on trends in pancreatic cancer incidence, death, and survival rates. The report also describes survival improvements by subtype. These improvements in survival may be associated with improvements in therapy, the researchers said. No improvement was seen for unspecified and other pancreatic tumors, which tended to have a higher proportion diagnosed at older ages than the other types. Thanks for watching. Please subscribe my channel for more videos.